Maverick Nichols with Orthopaedic Rehab Specialist is joining us today. Maverick, welcome back. Let's talk about the difference between PT and personal training.
Yeah, the two work in conjunction a lot of times, which is nice because I have a few friends that are personal trainers, and we kind of work hand in hand with patients because really both are about enhancing movement and efficiency of the body. But PT specifically is a little more early on in that rehab process. You know, acute injuries, basically getting patients back to the ability to maybe work with a personal trainer and progress with some of those strength goals. But first we need to kind of address those deficits and injury and get people rehabbed back on that path.
And so what can a person expect in PT?
Great question. For us, the first visit really is an in-depth evaluation. We're going to go through a screening with patients, see what deficits they have, limitations, range of motion, strength, things like that, and then start to tailor a program for those patients. And our goal is really to tailor that program per the individual. We want to really focus on what their goals are, what they want to get back to doing, and how do we move along that path with them.
And does someone need a doctor's recommendation to get physical therapy?
That usually depends on the insurance, but mostly yes. Yeah, get a referral for us.
And I understand that October is National PT Month. So what would you say to those younger individuals considering going into PT as a profession?
Yeah, we're really happy this month to kind of celebrate it because it's such an awesome profession. We really get to be one-on-one with our patients along that continuum of their health. We're really on the ground level, and unlike a lot of other healthcare fields, we get to be with that patient throughout a large part of their journey and really see that progress with getting them back to what they want to do. So, you know, the rewarding aspect is a huge piece of it, but there's also so much variability in the profession. I mean, you can work in different settings, outpatient, inpatient, hospital. So not only the rewarding aspect, but there's a lot of variety in the profession, which is really huge.
In ORS, you have facilities, what, how many of them now?
I think we're around 11 now.
Okay, yeah.
Around the Jackson and Lansing area.
Yeah. And what you really help people improve is their quality of life. And we don't have to live in pain, especially when someone, a professional like you and your coworkers, can help us find those ways to navigate through the pain and find better practices and be stronger.
Exactly. It's just one of those things that we try to rebuild the person from the ground floor if they need it.
And the thing that you said that I think really is worth repeating is you don't need a doctor's prescription to go to see you. You can just make an appointment and go if you're suffering from some pain.
Yeah, again, if with certain insurances. So sometimes we do have to have that doctor referral, but it's definitely a call to us and we can navigate that for patients, and oftentimes you can get that referral for them.
I love it. All right, Orthopedic Rehab Specialist, Physical Therapy. All the information is on the screen.
Thanks, guys.
Thanks, Maverick.